Welcome back to Nutrition Remarks. We already know that fish oils have lots of health benefits. Recently, Professor Phil Calder reviewed scientific evidence connected with fish oil and rheumatoid arthritis. He emphasized that fish oil can help reduce the rheumatoid arthritis risk and its complications. Here is Professor Phil Calder joining us from University of Southampton, United Kingdom.
Rheumatoid arthritis is an autoimmune disease. This is a disease where a person's own immune system is attacking their own tissues. In the case of arthritis, this is the joints, particularly in the hands and feet. There's a genetic susceptibility to rheumatoid arthritis, and this actually relates to this immune activity. In the disease, immune cells move from the bloodstream into the joints of the person. Here they interact with one another and produce damaging chemicals in a process called inflammation. It's these inflammatory chemicals that cause the symptoms of the disease: the joint pain, the tenderness, the swelling, the stiffness, and the loss of movement and function. Existing therapies to treat rheumatoid arthritis target some of these inflammatory chemicals. This is a cartoon comparing the joint of a normal person and a person with rheumatoid arthritis. So in the normal joint, we see a smooth, regular synovial membrane which is fully intact and uninflamed, and that membrane is serving to hold the synovial fluid, which you can think of as the grease that allows the joint to move properly, in place. On the right, we see the joint of a person with rheumatoid arthritis. Here we see a heavy infiltration of immune cells which have come in from the bloodstream. These include the classic inflammatory cells like macrophages and neutrophils. These cells are interacting with one another and are producing inflammatory chemicals and other immune signals. As a result of this infiltration and inflammatory activity, the synovial membrane becomes swollen and inflamed, as shown by the thickness here and the red color. Part of that membrane actually becomes a pannus, which is a particular structure which begins to invade the cartilage and joint, bringing about its destruction. This is another depiction of some of these interactions. So here we see cell type A, which perhaps is an antigen-presenting cell, interacting with cell type B, which is a T lymphocyte. As a result of that interaction occurring in rheumatoid arthritis, the T lymphocyte releases chemicals called cytokines. These in turn activate cell type C, which is a classic inflammatory cell like a macrophage or a neutrophil. When cell type C becomes activated by cell type B, it releases a whole range of destructive chemicals known as inflammatory mediators. It's these destructive inflammatory chemicals that actually damage the tissue, and it's the tissue damage that causes the symptoms like swelling, pain, tenderness, and stiffness. It turns out that omega-3 fats can be important in reducing inflammatory conditions, and it's long been known that omega-3 fats from oily fish and fish oils have anti-inflammatory effects. For example, these fatty acids are known to target the interaction between antigen-presenting cells and T lymphocytes, and they can also reduce the activation of the T lymphocyte. What this means is there's less drive to activate the inflammatory cell, cell type C here. However, these fatty acids also decrease inflammatory processes within the classic inflammatory cell, cell type C, thereby giving rise to a reduction in production of the classic inflammatory chemicals, particularly highly destructive reactive oxygen species, cytokines, and matrix metalloproteinases. Through these anti-inflammatory actions, omega-3 fats can serve to decrease tissue damage. In rheumatoid arthritis, this would result in a reduction in symptoms. Recently, we've carried out a systematic review where we looked at all of the clinical trials of omega-3 fats in the form of fish oils in patients with rheumatoid arthritis. And what we found when looking at all of this evidence is a number of studies have shown a relief of symptoms to a certain extent in patients taking omega-3 fats compared with placebo. So we concluded from our systematic review that there's reasonably robust evidence that omega-3 fatty acids have therapeutic efficacy in rheumatoid arthritis, acting through their anti-inflammatory actions.